What is integrative medicine? This was my first thought when I saw the list of electives that I could pick for my family medicine clerkship. In pretty much all of our rotations, we have 1 or 2 weeks where we can pick a subspecialty in that field to get a better sense of the types of careers that are possible through that specialty. When it came time to pick my electives for my family medicine rotation, there was only 3 options: community, integrative, and palliative care. The way it works is we rank those sort of 1 to 3, with 1 being the one we want to do the most. I didn't really have a strong opinion on any of them, but integrative was the one that I knew the least about, so I ranked it number 1. This was several months ago, and I kind of forgot about it until a few weeks ago where I got an email saying that that was what my elective was going to be. Like I said, I didn't really have a lot of experience with it, but I do remember that we had a lecture with the head of integrative medicine during our preclinical. He runs a whole integrative medicine clinic, but his main passion, I think, is nutrition and different GI disorders. With that passion, he works with local cancer centers to develop curriculum and teach their patients about the unique nutritional needs that they have as a result of their diagnosis. In preparation for this week, where I'm working with that integrative clinic, I looked up the definition of integrative medicine. And just from a simple Google search, I was kind of surprised to see how many big hospital systems have specific integrative medicine, integrative health departments. Traditionally, integrative medicine was described as a blend between Eastern and Western medicine. Now that terminology has changed a little bit, but the basic ideas still hold true. Now it's described as a blend between conventional medicine and complementary medicine. Now, conventional medicine being everything that is, well, conventional, pretty much everything that we've learned throughout medical school. Typical diagnostic tests, medications, surgeries, and complementary medicine being things that aren't traditionally used in a medical setting, like acupuncture, herbal supplements, massage, meditation. I think it's important to keep in mind that not everything is sort of promoted by integrative medicine. If you go to an integrative medicine practitioner at a hospital system, they're going to be using evidence-based medicine, whether it's conventional or complementary. Now, unfortunately, this week is a little bit shorter than it typically would be. I'm coming straight off of my spring break, so I'm only getting 2 days with different practitioners. Tomorrow is going to be with a nutritionist, and then Friday is going to be with an acupuncturist. Alright, so I just got done with my first day of integrative medicine. I was with a nutritionist this morning, and I got to sit in on like 4 or 5 of her patients. When I was scheduled for this, I was really excited because I have interest in fitness and nutrition, so I was looking forward to seeing how a professional in this field works. And not only that, but with it being within like a whole integrative clinic in a hospital setting, she has a lot of experience with taking into account people's actual medical diagnosis and integrating that into their diet. It was really great to see her approach to nutrition. It honestly wasn't what I was expecting. It really wasn't restrictive at all. Her main points were just eating whole foods, so things that don't have a lot of ingredients, even if they do have ingredients, things that you actually know what they are. I was really happy to hear that she is a huge fan of Trader Joe's. Even though Trader Joe's has a lot of different frozen options, when you look at the ingredients, you can see that there's not a lot of preservatives in it. They do a really good job of making things pretty healthy, honestly. So as someone who loves Trader Joe's and does most of his shopping there, I was happy to hear that I wasn't making bad decisions. Now, this isn't her own sort of coined term or advice, but what she was trying to explain to patients is she likes to think of food as what you can add to your meal, not what you're taking away. So once again, going back to not really that restrictive mindset that you sometimes see. She works pretty closely with a bunch of different specialties, most often bariatric surgery, and it's pretty funny because I just got done with my surgery clerkship, so a lot of the bariatric surgeons that she works with, who are right upstairs from her office, are people that I was able to work with during my rotation. And as I mentioned earlier in the video, the head of this integrative clinic does a lot of work with patients with cancer. So that's another part of her practice is, working with oncologists to meet the specific nutritional needs of that patient population. I was happy to hear that honestly, a lot of the patients had these nutrition sessions covered, at least in part, by their insurance. It was something that I did not think that insurance companies would cover, but she said that a lot of them will cover like 3 to 4 sessions per year. So she has patients spread them out, come back every 2-3 months to check up on how they're doing. And she always offers, feel free to give her a call or a message through the portal so she can, help out along the way. And I think the coolest part of today was I was able to help out in pretty meaningful ways. Especially on surgery rotation, there isn't a lot that you can do independently. Not a lot as a student that you're like really bringing to the table. Like obviously you can look up stuff if people have questions, but sort of in the moment when talking to patients, you don't really have much to offer in relation to the residents or the attendings. But as a result of my personal interests, my major in college, and also my medical school education at this point, I was able to actually help out some patients, and the nutritionist would look to me for my input or advice on a certain situation. One of them being fasting. Back in college, when I was trying to lose weight during an exercise physiology class in the summer, I was doing a lot of intermittent fasting. I was doing some longer fasts, like 36 hours. I did one 72-hour fast, so I had some experience with that. And one of the patients came in saying that in order to lose weight, he was trying to adopt fasting. So I was able to help him out, give him advice on like how to break his fast, what kind of things that he should be eating, the importance of staying really hydrated, taking electrolytes when you're doing it. So I felt good about that. There's also a patient who was going to start a GLP-1 agonist, which are these new medications that were originally for diabetes, but now they are approved for just general weight loss. So there's also a lot of considerations with that. One, honestly, being the supply issue. During one of my internal medicine weeks when we were in the outpatient setting, I had a lot of experience with patients coming in not being able to get certain doses, so I was able to help give some advice to the patient on how to navigate that. Also offering advice on what they can expect once they start it in terms of how they're going to feel and things to look out for from like a side effect point of view. And then finally, we were discussing with a patient what sort of choices they should make in terms of when they're at the grocery store and reading food labels. Should they be more concerned about dietary fat or dietary sugar, added sugar? The patient had a cardiac history, so he said pretty much any time he's shopping, that's what he's focusing in on is the dietary fat. However, he also has pre-diabetes, so sugar is a concern. So he's like, well, if I find something that's low sugar, it's usually high fat, and then vice versa. So like, what should I be concerned about? And I was trying to explain that the sort of older school view, what we used to think is that a high fat diet or high dietary cholesterol is going to raise your blood cholesterol, but there's been a lot of more recent research that kind of refutes that. It's not really, if you eat a lot of dietary cholesterol, you're going to have a higher blood cholesterol. But we were trying to explain that diabetes can, and honestly for a very long time, his lipid levels have been under control. So me and the nutritionist kind of came to agreement that maybe he should try to worry a little bit less about the higher dietary cholesterol foods and try to stay away from the high sugar foods. So all in all, it was a really great experience. I learned a lot, and it was nice to actually be able to contribute to the patient care. Alright, so it is Friday, so I am done with my week of integrative medicine, and today I actually got to work with an acupuncturist. I'm sure most people are pretty familiar with what acupuncture is, but just briefly, it's using small needles in specific areas to treat a variety of different disorders. I really have not had any experience with acupuncture. I've never gone myself. I do know people who have gone. I think my dad has used it and it's been pretty helpful for him, but I was excited to actually watch it be done and learn from someone who practices it every single day. So all in all, it was a very cool experience. I got to learn a lot about acupuncture in general, and then also sort of the different almost philosophies of it. So it is sort of rooted in traditional Chinese medicine. Definitely not an expert on it, but from what I gathered, their reasoning of how it works is it helps to unblock certain pathways of qi and sort of restore balance to the body. So like I said, that is sort of the explanation, sort of physiology, if you will, of the Eastern or traditional Chinese thoughts about acupuncture. So that is sort of how the practitioner that I was working with was initially trained, but she was saying how as acupuncture has become a lot more popular and widespread, and there's been so much real evidence-based benefits to this technique, people have been trying to sort of explain it in a Western way, or like a conventional scientific way, using what we know about the body, nerve pathways, how our body responds to different stimuli. So with that being said, there is sort of the traditional Eastern approach and a Western approach. And the person I worked with, while she was initially trained in the Eastern approach, sort of has to use a blend of it just because of the nature of, she works in a hospital system. Between patients, she had me read different books that were explaining sort of both of the styles, and I just found it really interesting to see how each of the styles sort of describe the body and how this technique helps it. So another thing that I was, not familiar with is even in sort of the Eastern approach to acupuncture, there's a bunch of different styles. She practiced more the Chinese style, but there's, other Eastern cultures like Korean and Japanese, and some of the other practitioners there use those different techniques or styles. So she was saying if she's working with a patient and initially, they're having a lot of success, but then they sort of plateau, then she'll have them go see a different practitioner who uses a different style, and sometimes it can help them break through sort of the plateau that they're on, and then maybe they can come back to her. Another big thing I learned is the wide variety of things that you can use acupuncture for. I think most of the patients that we saw, it was mostly for like general stress or chronic pain, usually like neck pain or back pain. And I guess generally how it works is, we'll go in, talk to the patient, see how they're doing since the last treatment. We'll see what their complaint is to pick out what areas we need to treat. She'll clean off all the areas where she's putting the needles, put them all in, and then sort of turn the lights off and has the patient relax there for a while. I think she said that she tends to go on the longer side of things. Some people will do maybe like 10 or 15 minute treatments and have people come back like multiple times a week. Finds that doing longer treatments and spacing them out more works better for her. So she would have the patient lay there for like 30, 45 minutes. And as I was saying, based on the specific complaints or the specific things they're trying to treat, she'll put needles in certain areas. So yeah, I think most of the patients were there for just like general stress, but she was saying how it's very good for like chronic neck or back pain. And since I said that I'm, pretty interested in orthopedics and sports medicine, she was talking about some of the conditions that you can treat with that. Frozen shoulder is a pretty big one because it can help sort of restore blood flow to the area, break up scar tissue, and even like post-op, she can use it to help prevent excessive scar formation, which I found pretty interesting. Once again, just increasing the blood flow to the area and just helping to promote healing. And it was just generally really nice to hear how grounded in reality the practitioner was. A lot of these alternative or complementary medicine techniques get a bad rap, and honestly, it's sometimes for a good reason. Especially in the age of social media, you have so many people out there spreading misinformation. There's people out there who are trying to sell you their personal supplement that they say is going to cure any disease that you have, and trying to push you away from more conventional styles of medicine, saying that you shouldn't go see doctors, you shouldn't take antibiotics. But the acupuncturist was very realistic in what she could and could not help with. She was telling me about a patient that they had recently who was diagnosed with cancer that was initially treatable, but she was refusing all forms of conventional medicine like chemo and radiation, and instead wanted to be treated only with like more complementary or alternative styles of medicine, like herbal supplements and acupuncture. And she told me that every time this patient would come in, she would try to explain how the services that she was providing, the acupuncture or herbal medicine, is meant to complement the more conventional treatments for cancer. She made it abundantly clear that she could not cure her cancer with her acupuncture needles. Now, it was the patient's decision to still refuse those treatments, but it was nice to hear that she was having very candid and honest conversations about what the role of her complementary medicine was. And I know the vast majority of practitioners out there are like that, but you tend to not see them that much on social media because the more controversial or loud people tend to go viral. All in all, this was a great experience this week. I honestly think that this should be like a required part of the family medicine rotation, just because it gives you really good insight into different ways to help people and gives you a more holistic view of treating patients. So I'm pretty glad I was able to get it as my selective. All right, well, that is going to do it for today's video. If you enjoyed, please be sure to leave a like below and subscribe if you want to see videos like this in the future. Thanks, and I'll see you in the next one.